Hey guys, I'd figured I'd come at you with another life update because if you watched my last video, I discussed that I have thyroid cancer. I don't know if I said anything. I don't know if I knew then. I think I knew that I was getting tested for it. But my lymph nodes also came back on this side, the left side, as having cancerous tissue in there. So I'm going in 1 week from today to have my full thyroid and my like an entire group of lymph nodes on this side of my neck removed. This side came back okay, so they don't have to touch this side yet. But I just wanted to tell you a little bit about all the fun stuff I learned at my appointment yesterday. So first of all, they are going to make an incision from behind my ear down and over past my thyroid so that they can get in there and all that good stuff. They will definitely be cutting some nerves to get into there, that big space. It's a big space, so they have to cut some nerves. But they're just like, they're not any motor sensory, whatever they're called, nerves. So I'm gonna be numb in a big spot for a while, and then it's gonna slowly go down, but I'm gonna be numb forever for like, I guess the size of the incision. Plus he said usually the earlobe gets numb for some reason, despite the fact that they're really not touching my earlobe. But I guess because it's like right behind it. So there are other nerves in there that could possibly get damaged, and those include the nerve that moves your shoulder. So if that nerve gets damaged, sorry, this is shaky ass camera work. If that nerve gets damaged, I won't be able to lift my shoulder for a while, maybe ever, and I would have to go back for physical therapy. And one that could get damaged is one that's like controls like this part of your lip motion, so that when you smile a little uneven. Like instead of smiling like evenly like this, it would like stay like this, I guess he said, and it would smile, which I don't care as much about like cosmetic stuff, so that one doesn't bother me too much. But there is one that's scary that moves and controls your tongue, and if that is cut, tracheostomy, something has to be done, and then like because I won't be able to like swallow or I guess maybe talk anymore because I won't have a tongue. Or I'll have a tongue, but it won't work. I don't know. We didn't really get into it yet. We'll see what happens when we get there. He's really confident that none of that is going to happen because it's small enough yet that it shouldn't be too wrapped around anything. He did say it could be wrapped around like some blood vessels or possibly like my jugular or my carotid artery, which is a little more serious. I think he said you could live without a jugular on one side because you have one on the other, but the carotid artery you definitely need, so if it's in there I'm a little bit fucked, maybe very fucked. But it's probably like smaller, like blood vessels and veins and stuff are probably going to get intertwined with the cancer, so some of those might have to get taken out. And then he said sometimes it wraps around like the muscle that comes down here, so I might have to have some muscle taken out depending on like if it's really like attached itself to any structures in there yet. And then other things, like one thing that will happen is because he's removing all of this tissue from my neck, it's going to, he said your body will want to fill it up with something. So they're going to have to put drains in there so it will drain any fluid that my body tries to fill in there, so that it will like heal together instead of healing with like fluid in there. And he's like, it could be what he called serum, or it could be blood, or it could be whatever, so they don't want that to happen. So I'll have to have drains in my neck for like 4 or 5 days, and I'll be in like an overnight surgery center kind of deal, and I'll be in there for a couple of days and they'll be taking care of that for me. And he said, obvious in like surgery risks like bleeding and infection and all that kind of crap. He was like, it's very rare because they try to do, well, especially the infection, because they try to do such a good job. It's like a sterile environment and all that kind of stuff. So those are the like things that might happen. Probably about 2 months down the road from now, I'm gonna have to take a pill that is radioactive iodine, which your thyroid, he said, apparently when you have thyroid cancer and it metastasizes to other places in your body, it's technically still like thyroid tissue, even though it's like in my lymph nodes now, and then from my lymph nodes, let's say it travels into my I don't know, my kidney or something. Hopefully that doesn't happen, but let's just say that happens. So he said that's still thyroid tissue, so if we put radioactive iodine, like take a pill, it will, that thyroid tissue that is cancerous that has traveled through my body, it will soak up the radioactive iodine and it'll kill that without killing any healthy cells, hopefully. He said it won't, but I feel like there's always a risk of that kind of stuff happening with like radiation and stuff, because I can't be within 6 feet of anybody, including my pet, for 3 days because I'll be radioactive for 3 days, and like I'll be radioactive and stuff. So that'll be an issue, and maybe I'll just ask him if I can go to the hospital, because then they know how to take care of that shit. I don't know how to take care of that shit. And I don't want to accidentally like not infect, because it's not a disease, but like accidentally contaminate my family or my dog. And then like I could possibly stay down where like my apartment area is, but I don't have a bathroom down here, so I would either have to like call up and be like, yo, everybody get out of the way because I have to go to the bathroom, which seems like that wouldn't work. So I'm gonna see if he can put me in the hospital. The most stressful thing out of like this whole situation has been trying to get time off of work, because I already had all my sick days used for this year, and the day of my surgery, like that week was fine with my boss, but the following week, I work in a department of 10 people, and we need everybody that's there. It's not like we're doing stuff for later. We work with people, real time kind of stuff. It's not like I'm working on a document at home that I could just do from somewhere else, or that I could just do later, or work on like a SAC pilot earlier. So my department's already down 2 people that following week, and possibly it was going to be another person because of some health issues of theirs, but they're okay, thankfully. And luckily they found people to like work and stuff for me. Like they're going to figure it out, because if I couldn't have gotten my surgery done on the 25th of this month, which is October, I would have had to wait until the end of November, beginning of December. And even though the doctor said my cancer is slow moving and not super aggressive so far, I don't want to risk anything. I want to get it over with. I want to start like recovering again, or yeah, whatever I'm trying to say. And I just want to like move on from this, kind of. I know it's going to be a while, but I want to get that process started so it doesn't spread anywhere else. So I'm going to be out of commission for 2 weeks, and then I'm not going to be able to like turn my head for a while, for like at least those 2 weeks, if not longer, and I can't pick anything up, or like, what was he saying? What was the other thing that I can't do? Oh, my throat is going to be hoarse for a while after this, probably. And because the thyroid sits on top of your vocal box, it could get damaged in the process, meaning that I could be hoarse for the rest of my life. And the job that I work in, I talk to patients 24/7, not 24/7, but like 8 hours a day, 5 days a week. So that would not be good for my job. So I'm really hoping that doesn't happen. That's a little bit scary, because I don't know what they would do with me if I couldn't talk. Because like, if I can't talk to the patients, I can't do my job. I can't answer the phone. I can't check people in. I can't check people out. Like, I don't know. I don't know what they would. They don't really have a position available where you don't have to talk to people. So I would possibly have to, depending on how bad it is, figure something else out. And that's a little bit stressful because of like, you know, cancer surgery costs money, and so I have all these like medical bills, and it's like a $60 copay every time I go to see him, and I've seen him like 4 times, and like I've had all this testing done, and I saw my other doctor first, and I was in the hospital in February for something that might have been related that I didn't know at the time. So like that's kind of stressing me out, but all I can do is just like wait and see and hope things turn out okay. And he said he's confident that everything will be okay because, like I said, my cancer luckily is small. We caught it fairly early. Like it did metastasize, but it's not to the point where they're like 3 or 4 or 5 times the size that mine is. Mine's only slightly above normal size for like a lymph node. My lymph nodes are only slightly, whoop, fucking stupid tripod thing that I'm holding you on. So, I guess I'll give you an update from the surgery center or something, maybe, depending on if I can talk. If I can't talk, I don't know. Maybe I'll see you in a couple of months or something. But I guess that's just gonna be it for now. Please don't like mind this is my natural texture of hair, which is basically crap because I just got out of the shower and it's air drying. So please don't mind my like gross hair and like no makeup and bad lighting and shoddy camera work. I just wanted to put this up here. So, alright, I'll talk to you later.